The more contagious Omicron variant is breaking case records, reaching people who had previously managed to avoid infection and reinfecting others. It's been sidelining workers, filling our hospitals, and closing our schools. Lately, it can feel like we've undone a lot of the progress we made in 2021. So what can we do now? I'm Kelly Tyrell. This is Badger Talks. Today we're talking about the Omicron variant of COVID-19. Evidence seems to suggest the illness it causes is milder than earlier versions of the virus, especially for the vaccinated. But it's caused a troublesome surge. Dr. Devlin Cole joins us. She's a preventive medicine physician at the School of Medicine and Public Health. Dr. Cole, thank you so much for joining us.
Thanks for having me, Kelly.
Especially in communities with high vaccination rates, like here in Dane County, Omicron largely presents a lower personal risk to us as individuals, and many of us had started resuming activities we'd paused before vaccines were available. Does Omicron force us to think differently about our collective risks?
Yes, it's a really good juxtaposition that you've brought up. What can we do to make sure that we ourselves are as safe and healthy as possible? And then what do we need to do as a community to make sure that we aren't spreading this virus from person to person? So the good news is that it looks like Omicron has less personal risk, meaning especially if you're vaccinated, but even if you're not and you get it, there are lower chances that you personally would end up in the hospital. However, because Omicron is spreading really fast, we have to think about the numbers of people that are going to get Omicron, which is higher. So even if the individuals are lower in the hospitals, we're still seeing more cases, which it does feel a lot like we are kind of reliving this in a groundhog style way. We're seeing the same kind of overrun hospitals. And this time we're having staffing shortages because all of those doctors, even though they're vaccinated, nurses on the floor, respiratory therapists, everybody is kind of getting hit with the virus. And now we have less people able to take care of those that are sick.
Thanks. So when we're thinking about going out in public and having social interactions, given that a lot of us are vaccinated and protected, but we are seeing this surge and it is affecting our hospitals, how can we take steps to balance our relatively lower personal risk with reality that we're more likely to encounter the virus since there's more of it out there and we could unintentionally spread it and contribute to the surge?
Absolutely. Here in Dane County, we have kept our masks on since pretty much August. So that's a great first step. A lot of places elsewhere are adding that mask step on now. So we aren't going to see that change, but know that your mask is protecting you. If you haven't been vaccinated or boosted, now is a great time to do that. Add as many protective layers as possible. And then what I recommend to people is you can still go out and do the things that you want to do, but it's going to take a little bit more planning. So if I know that my grandfather's birthday is coming up in 2 weeks, I'm going to spend the time ahead of leading up to that, going out to restaurants less and eating in more, not necessarily seeing as many people as I might if I didn't have something that I was looking forward to coming up. So definitely take the time to prioritize what it is that you want to go out and do in the social world, and then add in all of those protective steps. If you can, test with a rapid test the day of before you go to an event where you might expose people. I highly recommend that. You can even plan ahead and schedule a test for right before if you've got something coming up. And then go ahead and give yourself some buffer time on the other side. I've just gone out and seen a whole bunch of family members. I'm going to stay in to myself for maybe 4 or 5 days just to see if that exposure did lead to symptoms. And if it did, I can go ahead and protect everybody around me, let them know I'm having symptoms, get tested if I can, and then isolate appropriately.
Thanks, Dr. Cole. If you do get sick, especially as somebody who's vaccinated and boosted, so you've done all you can do, what are the best things you can do for yourself while you're sick and maybe while you're looking out for others?
So if you do end up getting sick, what I would recommend is right now before you're sick, plan ahead. Go out and get the kinds of over-the-counter medicines that might make you feel better when you're sick, and go ahead and buy a thermometer. And some people are finding when they are getting sick that their symptoms are more mild than they were expecting, which is great. But it is still a flu-like illness, so I would anticipate really not feeling well for quite a few days. And some people really are still feeling the full effects of the very severe symptoms of COVID-19. So if you are struggling to breathe, or if you have a high temperature, which you will know because you bought a thermometer, those would be great reasons to go and call your doctor or go to an urgent care or an emergency department so that you're making sure that you're getting the medical attention that you would need. And part of this planning step for maybe getting sick is a really nice way to kind of bring the focus to yourself and figure out, how can I take care of me? What do I need to make it through the next couple of months? And I know we're all getting a little bit of compassion fatigue, which is when it's really hard, it's really tiring to continue to make decisions that are inconvenient for you in order to take care of others. And so one of the ways that I recommend when people are getting compassion fatigue is just to pull in and start having compassion for yourself. So letting the things that you're doing be enough, and going out and planning and surrounding yourself with things that are going to make you feel better now and if you do end up getting sick.
Thank you, Dr. Cole, for joining us. Your compassion and your wisdom are so important.
Happy to share.
If you have questions for us, topic suggestions, or want to comment on this Badger Talk, please send us an email at covid19update@uc.wisc.edu. And for more information, you can go to covid19.impact.wisc.edu. This is Badger Talks.